Dengue fever. In dengue previous part, we have dealt with what is the what is dengue fever, what is the classification of dengue fever. In this part, we are dealing with what is the diagnostic measures of dengue and what is the management of dengue fever, what is the prevention and control of dengue fever. Dengue fever is very important disease, and when we identify early, it can be easily controlled. And general public have to aware of the dengue fever for the control of disease. So we can move on to the diagnostic measures of dengue fever. Regarding the diagnosis of a dengue fever, mainly the CBC values will be have variations. The patient will have leukopenia, the WBC count will be decreased, thrombocytes or platelet count will be decreased, then increased SGOT, SGPT levels, then rising AB titer in paired sera, then NS1 detection in ELISA test, then IgM capture in ELISA, then IgG ELISA significant of past infection, then reverse transcription PCR confirmatory. So these are the laboratory diagnosis or laboratory findings that conclude the dengue fever. Then CAR test also we are doing for initial purpose. For initially we are doing the CAR test, then we are assessing the NS1 antigen in order to confirm the cases. Then reverse transcription polymerase chain reaction also confirmatory test for dengue fever. Dengue prevention and control. We knew that dengue transmitted by vector Aedes aegypti. It's a mosquito, right? So mosquito control is the main management of dengue fever. Here we have to protect the family from mosquito bite. So daytime mosquito bite is very important in case of dengue fever. So we have to avoid the mosquito bite during the daytime, especially the 6 to 8 and 4 to 6 time is very crucial. Then wear protective clothing like long sleeve and shirt and pant in order to prevent the bite. Then use mosquito net while sleeping. Otherwise, you can use the mosquito ointments. Then keep your surrounding clean, both indoor and outdoor. If the surroundings is clean, there will not be mosquito breed environment. So that's why there will be reduction in the mosquito. Then avoid stagnant water in surroundings. The stagnated water, there will be the mosquito will put larvae, put eggs, and they will become larvae and they will become the mosquito. So the stagnant water we have to avoid. Then use mosquito repellents like coils and spray that will helps to reduction of mosquito in our home. So it's very important, especially in dengue area, the mosquito control is very essential and we have to follow that. Next one, management of dengue fever. Management of dengue fever, the general category, if there is outpatient services needed, that time the bed rest is the advisable method. Okay. Next thing, we have to use cold or tepid sponging in order to reduce the fever. Then antipyretics in order to reduce the fever. But here we have to avoid aspirin, meftal NSAIDs like drugs, because there may be chance for bleeding. So that should be avoided. and the dosage will be for 1 to 2 years, that is 6 to 120 mg per dose, 3 to 6 years 120 mg per dose, 7 to 12 years 240 mg per dose, adult 500 mg per dose. So that is the dose of antipyretics. And oral fluid and electrolyte therapy is recommended for patients with excessive sweating and vomiting. If the patient, mostly the patients will have nausea and vomiting. So if it is excess, that patient need oral fluid therapy or the electrolyte therapy is needed, like ORS. Okay, then patient should be monitored for 24 to 48 hours after they become febrile or for development of complications. So here we have to monitor continuously for this patient in order to identify if there is complications. Okay, so in order to identify the complications, we have to monitor the patient continuously. If the patient become more serious or always confined to bed, that may be a warning sign. So we have to monitor always this dengue patient. So the class A or the general group dengue classical type, there is no need of uh, inpatient service. We can treat the case as an outpatient. Next, in case of dengue hemorrhagic fever, the category 1 and category 2, we have to initiate this patient with the IV therapy, and IV therapy that is based on the kilogram weight of the patient, and if there is improvement, we can gradually we will decrease the amount of fluid, and good improvement is there, we have to stop the IV fluid. And during this time, we have to check the hematocrit values. And if the hematocrit values improved, again we will gradually decrease the IV fluids. If there is no improvement, we will increase the crystalloids. That means if isotonic solutions, we will give the NS, we will give the RL based on the patient need, we will give the IV fluids. Especially we starts with 6 ml per kilogram per hour. Then if there is no improvement in hematocrit value, we will increase the dose, that is 10 ml per kilogram per hour. Then we will monitor the condition again. Then if we are suspecting internal hemorrhage, we will uh, give for the blood transfusion. We will administer the blood transfusion for this patient. If there is improvement, we will gradually the crystalloid therapy will be continued. And if there is further improvement, we gradually discontinue the crystalloid therapy. So that is the volume replacement algorithm in case of grade 1 and grade 2. In grade 3, that is volume replacement algorithm for patients with a dengue hemorrhagic fever, grade 3. Here the patient will show the circulatory failure. Okay, so there may be chance for the compensated shock. Pulse pressure will be less than 20 millimeter Hg. Hypotension, systolic hypotension will be present. Then high hematocrit values will be present. So in this condition, we are start with the IV therapy, that is 10 to 20 ml per kg crystalloid solution. So here not only crystalloid, we are also give colloid solution. Crystalloid main solutions are normal saline and ringer lactate. And if there is improvement in vital signs and hematocrit, we will start the IV therapy by crystalloid and successfully reducing the low blood flow from 10 ml per kg to 6 ml per kg, then 3 to 1.5 ml per kg. So based on the patient improvement, we gradually decrease the IV fluid, and we will discontinue based on the improvement in the patient. But in case of there is no improvement, in vital signs, we have to again check the hematocrit value. If the hematocrit value rises more than 45%, we have to start with IV colloid, that is dextran. We have to start with the dextran. Then if there is no improvement, we have to use the IV inotropes like dopamine, dobutamine, etc. We have to start. If the HCT falls, suspect bleeding, then we have to give the blood transfusion. That is based on the patient condition, and we have to continuously observe for the refractory hypotension, acidosis, bleeding, calcium levels, and then sodium potassium levels, electrolytes we have to continuously monitor. Then along with that, we have to monitor the sugar level. And if there is again, if there is no improvement, we have to give the emergency management like inotropes we have to start. So these all are the management of grade 3, that is dengue hemorrhagic fever grade 3. Next one, dengue hemorrhagic fever grade 4, that is the dengue shock syndrome. That is the last stage of dengue fever. Here the patient will be in profound shock. There will be signs of shock. BP will not be detectable, and high hematocrit value will be present. Bleeding will be spontaneous. So we have to start with the airway breathing circulation. Oxygen should be administered first. Then rapid fluid replacement therapy should be started, and crystalloids and colloids we will be given. And if there is improvement in function, we have to give the crystalloids. Then further evaluation will be done. But in case of no improvement, we have to repeat the 10 to 20 ml per kg crystalloid or colloid solution or the bolus solution up to 15 to 30 minutes. Then again hematocrit values we have to assess. Then IV colloids have to continue, and if there is no improvement, we are doing the inotropes. And in case of hematocrit values will be, if there is fall in the hematocrit, we have to suspect bleeding again, and blood transfusion, platelet transfusion, or whatever it is, RBC or all blood, all this transfusion have to be done. And we have to assess for the refractory hypotension, acidosis, bleeding, calcium levels, sodium potassium levels, and the sugar levels also we have to assess. And if there is further movement, we have to do based on that. Otherwise, we have to done for the we have to do the emergency management like inotropes. So these all are the management of dengue fever.